experiencing stroke symptoms, call 911 first and get to the hospital. Don't delay. If you think you're having a problem, let us know you're not. Having a comprehensive stroke center is vital to a community because in stroke, time is brain. So having a center where we can effectively and quickly intervene on a process that really matters is vital. We have a comprehensive group of neurologists and neurosurgeons who work together to manage sort of the breadth of stroke care, whether it's a ruptured aneurysm or ischemic disease and large vessel occlusions. A ischemic stroke is when you have a pipe that is occluded, so blood doesn't get to where it's supposed to get to. Versus a hemorrhagic stroke, you have a pipe that's burst, and now there's a bigger surrounding problem.
Just always really important for our community to have an understanding of stroke signs and symptoms so that they know what to look for and also what to do when a patient's having a stroke. We always use the acronym BEFAST. So B is for balance, E is for eyes, F is for face, A is for arms, S is for speech, and T is for time. All you need is one of those signs or symptoms. And if you or a loved one ever notice these signs or symptoms with anyone, you want to make sure that you call 911 immediately.
We have very close communication with 911. When they arrive on the scene and a patient's having stroke symptoms, they call us ahead of time and let us know about the case that they have. And if it's a case of suspected stroke, we immediately mobilize our ER team, and we in fact meet the patient by our CAT scanner and do an initial evaluation right outside our CAT scan room, and then quickly get the patient into the CAT scanner so we can determine whether or not a patient's having a stroke. Then we can intervene and reverse that stroke as soon as possible. It's so important to call 911 when you think you're having a stroke, because there's a very small window of time when we can do our interventions. I've absolutely had patients who have waited at home until outside our time limit, thinking, well, let me just wait a little bit longer and see if the symptoms go away. And that is the wrong decision to make. The decision will be made off of the findings in the CAT scanner as to whether or not the patient can benefit by a blood clot medication that can break up a blood clot that's blocking the blood flow to the brain.
Managing stroke includes rapid imaging, including scans of the head. A certain subset of patients gets taken to an angiovascular suite where we do cerebrovascular studies. And it's basically an operating room with two independent machines that allow us to obtain three-dimensional imaging and watch blood flow or watch where the actual obstruction is. The majority of strokes may be ischemic. Within that, there is a subset of patients who have large vessel occlusions, where in addition to medications, a lot of times we're able to go in and actually remove a clot and really have dramatic effect on outcome. There's a subset of patients who have hemorrhagic strokes where a neurosurgical team is needed to back up the neurologists and really make sure that whatever you need, we're able to provide quickly and 24 hours a day. Time is brain, so the quicker the better. So the sooner you can get here, the sooner we can lay hands on you, the better you're gonna do. So as the Peninsula's only comprehensive stroke center, we are sort of the hub where all hospitals in the community can send rapidly patients that are experiencing stroke symptoms for further evaluation and management, including intervention, which I think makes a huge difference in people's outcome.